Hello, my name is Elizabeth and I'm an occupational therapy assistant student at Bryan and Stratton College in Wisconsin. Today I will be going over dressing techniques for individuals with hemiplegia or other deficits that involve the use of one upper extremity limb. This video is designed to educate viewers like you on one-handed techniques to assist with dressing the upper and lower body. These techniques can be beneficial for individuals who have weakness or restrictions to one arm, individuals who have experienced flaccid or spastic muscles in one extremity, individuals with amputations on an upper extremity, individuals who have hemiplegia, as I mentioned before, and individuals who have orders from a physician not to use an upper extremity in the case of a cast or splint, and limited range of motion and strength are set in therapy protocol. Before we get started, it's important to note that patients should be seated when possible and have access to a stable surface or locked ambulation device when standing for balance and stability. If you or a patient is at fall risk, make sure that you or they have a call button nearby or a phone that is accessible. Grippy socks or socks with shoes should be worn before standing. I will go over techniques on how to put on socks and shoes with one arm later in this video for reference. But first, let's look at the materials you may need. Here is a list of the clothing items I will be using in this video for dressing. A front opening shirt that buttons and/or a pullover shirt if you'd like, trousers, shorts, or sweatpants depending on your preference, socks or stockings, and a pair of shoes. If possible, select slip-on shoes to eliminate lacing and tying. Elastic laces are also a good option for those who would like to adapt their existing shoes. Next, here is a list of the dressing tools I will be using in the video to aid with dressing. A long-handled shoehorn, a dressing stick, a reacher, a button hook, and a sock aid. Any of these items can be found online or at your local drugstore. If you have any questions about these devices, please leave a comment below or ask your treating therapist for help. If you have other clothing that you'd like to wear, you're more than welcome to use that instead, but may need to consult your therapist if techniques shown in this video don't quite work for you. It's also easier if you're able to lay out all of your clothing at once instead of gathering the items you need sporadically throughout the video. Please take a moment to collect your outfit for the day or the articles of clothing you'd like to practice with, and I'll meet you back here. Dressing techniques for the client or individual with hemiplegia or other restrictions employ neurodevelopmental treatment principles. The following one-handed dressing techniques can facilitate dressing for clients with use of one upper extremity. As a general rule, place the affected extremity in the garment first when dressing and remove last when undressing. This procedure allows more room to work with the garment when motor control is most impaired. Let's get started with basic overhead dressing techniques for front opening shirts. This first method can be used for jackets, robes, and front opening dresses as well. We'll start in a seated position with feet flat on the floor for support and stability. Place your affected hand on your lap to reduce the amount of gravity and weight pulling down on the shoulder joint. We don't want to create any extra tension for subluxation to occur. To begin, grasp your button-up shirt collar with your unaffected hand and shake out any twists or wrinkles that could cause entanglement. Next, place the shirt on your lap with the inside facing up and the collar facing toward your chest. When you are ready, position the sleeve opening on the affected side so that it is as large as possible and close to the affected hand, which is resting on your lap. Using your unaffected hand, place the affected hand in the sleeve opening and work the sleeve over your elbow by pulling on the garment. Ensuring the sleeve is placed over the elbow will help prevent shoulder injuries when placing the shirt over your head. Next, put your unaffected arm into its sleeve and raise it or slide it or shake it into position past your elbow. With your unaffected hand, gather the middle of the shirt from the back hem to the collar and raise the shirt over your head. Be sure to lean forward with safety and duck your head to pass the shirt over it. Your unaffected hand will adjust the shirt by leaning forward and working it down past both shoulders. Reach in back and pull your shirt tail down if necessary. Line the shirt fronts up for buttoning. I will go over an adaptation that can be made later for buttoning a front opening shirt. If the overhead method doesn't suit your specific needs, there is another option for putting on a front opening shirt. Again, we'll start in a seated position with feet flat on the floor for support and stability. Place your affected hand on your lap to reduce the amount of gravity and weight pulling down on the shoulder joint. To begin, grasp your button-up collar with your unaffected hand and shake out any twist or wrinkle that could cause entanglement. Next, place the shirt on your lap with the inside facing up and the collar facing towards your chest. When you are ready, position the sleeve opening on the affected side so that it is as large as possible and close to the affected hand which is resting on your lap. Using your unaffected hand, place the affected hand in the sleeve opening and work the sleeve over your elbow by pulling on the garment. Start to pull your sleeve on the affected arm up to your shoulder. With your unaffected hand, grasp the tip of the collar that is on the unaffected side and lean forward. Bring your arm over and behind your head to carry the shirt around to the unaffected side. Place the unaffected arm into the sleeve opening, directing it up and out. Adjust and line up the shirt fronts to prepare for buttoning. Now that you have your front opening shirt on, it's time to button up. Although many individuals who are one-handed are capable of buttoning up their shirt with one hand, it may be easier and more time efficient to utilize a button hook device. To start, hold the button hook in your dominant or non-affected hand. Next, thread the wire hook through the buttonhole of your shirt. This device can also be used on pant buttons as well. Now, place the wide part of wire over the button in preparation for threading the button through the hole. When you're ready, pull the button through the hole of the shirt and remove the wire from around the button. This may take a few tries to get used to, but patience is key in the beginning. Feel free to slide your hand down the wire to assist as well. If you'd prefer to wear a pullover shirt instead of a front opening shirt, or you wear a pullover shirt under your front opening shirt, this technique will help. We'll start in a seated position with feet flat on the floor for support and stability. Place your affected hand on your lap to reduce the amount of gravity and weight pulling down on the shoulder joint. Now, position the shirt on your lap with the bottom towards your chest and the label or front side of the shirt facing down onto your lap. With your unaffected hand, roll up the bottom edge of the shirt back up to the sleeve on the affected side. Start to position the sleeve opening so that it is as large as possible, and use the unaffected hand to place the affected hand into the sleeve opening. Pull the shirt up onto your arm into the sleeve. Adjust the shirt on the affected side up and onto your shoulder. Next, gather the back of the shirt with your unaffected hand, lean forward, duck your head, and pass the shirt over your head and adjust as necessary. You're doing great and we're almost there. Now it's time for the lower half. This next demonstration will walk you through step by step on how to put on your pants or shorts. This method can also be adapted for boxers and women's panties as well. Velcro or elastic may replace buttons and zippers. Trousers should be worn in a size slightly larger than worn previously and should have a wide opening at the ankles. They should be put on before the socks and shoes. To avoid falling, we will dress the pants as far up the legs as possible while staying seated. Once we have the pants on partial way and our socks and shoes are on, we will stand up to pull the pants up the rest of the way. Wearing proper footwear such as grippy socks or shoes is safer when we stand. This method also conserves energy and prevents the client from having to stand multiple times. A client who is dressing in a wheelchair should place feet flat on the floor, not in the footrest of the wheelchair. We'll start in a seated position with feet flat on the floor for support and stability. Place your affected hand in your lap to reduce the amount of gravity and weight pulling down on the shoulder joint. Sitting in a sturdy armchair or locked wheelchair, use your unaffected hand to reach forward and grasp the ankle of one leg and lift it over the other leg in a cross position. Slip the trousers onto the top leg up into a position where the foot is completely inside of the trouser leg. Do not pull up above the knee yet, or it will be difficult inserting your other leg. Uncross your legs by grasping your ankle or setting your foot down slowly. Insert your other foot into the trousers on the floor and work trousers up onto your hips as far as possible. If you have poor sitting balance or prefer to use a reacher for safety, this is an excellent time to do so. Pull the pants up over the knees as much as possible and stop there. We'll move on to socks and shoes and come back to the pants when we are ready. Now that we have our pants on, it's time to put on our socks or stockings. If you only wear socks around your house, make sure they are socks with grippies. Start in a seated position with feet flat on the floor for support and stability. Place your affected hand in your lap to reduce the amount of gravity and weight pulling down on the shoulder joint. If you have a sock aid, I will be demonstrating how to use it in this next part. Feel free to pause the video to grab it now if you'd like. First, sit up tall in your chair and place the sock aid in between your legs with the rope end down. With your unaffected hand, Try to open the mouth of your sock as much as you can to create space to slide it onto the top of the sockade. Squeeze your legs together around the sockade to create a smaller U shape with the lip of the sockade. Using your unaffected hand, begin to wrap the opening of the sock around the lip of the sockade until the entire opening is covering it. This may take a couple of attempts to get the sock onto the lip of the sockade. Be patient. Once you've got the opening of the sock on top of the sockade, start to slide the opening of the sock down the length of the sockade, adjusting as you go. You want to slide it down until the toe of the sock meets the top of the sockade. Once the sock is completely on the sockade, grab the ropes with your unaffected arm and position the open end of the sockade in front of your foot. Place your foot into the opening, lining your toes up with the end of the sockade. Pull the ropes towards you to slide the sock onto your foot. Repeat on the other foot when you are done. Last but not least, we need to put on shoes. If possible, select slip-on shoes to eliminate lacing and tying. Remain sitting until you are fully dressed. We'll start in a seated position with feet flat on the floor for support and stability. Again, place your affected hand on your lap to reduce the amount of gravity and weight pulling down on the shoulder joint. If you have a long-handled shoehorn, we'll be using it at this time. Feel free to pause the video to grab it now if you need to. First, put your shoes down in front of your feet while you are sitting. Starting with the foot on the same side as your unaffected arm, begin to slide the first half of your foot into your shoe, keeping your heel lifted out of the shoe. Using your unaffected arm, place the wide end of the shoehorn into the heel of the shoe behind your foot, just like so. Slowly begin to guide the heel of your foot down the length of the shoehorn and into your shoe. If you need to adjust your foot, you can always use a dressing stick or reacher to do so. To dress your other foot, place the shoehorn in between your legs to cross over to the opposite side, following the same steps as before, like so. Now that we are safe with our footwear, it's time to pull up our pants the rest of the way. To prevent trousers from dropping when pulling pants over hips, place the affected hand into your pocket or place one finger of the affected hand into a belt loop. If able to do so safely, stand and pull your trousers over your hips. When you're ready, remove your arm from the pocket or belt loop. The tips in this video were intended to educate you on some easy ways to dress or don clothing using one upper extremity. If you have a different system set up by your therapist, make sure you follow their lead first. Always remember proper footwear before standing for any dressing task and start with your affected side when dressing the upper body first. I hope you found these tips helpful and try them out for yourself. Please leave a comment below if you have any questions for me regarding the information provided. Therapists, we would appreciate and love your feedback regarding implementation of this video. Please take a few minutes to complete the brief survey using the provided link below. I hope you found the information in this video helpful for one-handed dressing techniques. Thank you again, and until next time.